Hi, and welcome back to another edition of Interstitial Cystitis Chronicles 2. Don't forget the 2 on the end. And don't forget to subscribe and like to the channel. Okay, so for today's topic, we're just going to get into it. We are going to discuss Botox. Bladder Botox. Now, when this was first brought to my attention, I thought, Botox? Wrinkles? Botox. Muscle of the bladder? Paralyze? Frown lines. Paralyze the bladder. I'm not understanding. But I was excited though, because in a previous video where I talk about the cystoscopy, hydrodistension, and installation, but when I had the urodynamics in another video as well that I've discussed, at that time, the doctor was deciding what would be the best treatment plan for me. He ruled out Botox because he said during the urodynamic testing that my detrusor muscle was not spasming. So he figured, okay, we're going to do an installation for you. And plus, he had some doubts about it because at the time I was in the middle of a move out of state. And he didn't know if a side effect was going to be me having to cath if I did get Botox. Moving forward. Okay. I got a new doctor once I did move, and I was inquiring about Botox. So the doctor had Botox twice. Okay. So let me get that out of the way. So the first doctor whose attention I brought it to, he was on board to prescribe the injections. So he did 100 milligrams. I was prepped by the nurse, just as if I was being prepped for a cystoscopy. And I remember watching the procedure being done on camera. So I'm seeing this needle poking into my bladder. No, I was not under general anesthesia. He just injected the Botox into my bladder. And honestly, it felt like a pinch and it wasn't unbearable for me. But again, as we know, everyone is different when it comes to procedures, treatments. But I did fine with it. But just the fact that, I actually saw the needle poking into my muscles of my bladder, it looked I don't know. I couldn't watch, but I could watch because I was fascinated by it. And at the same time, seeing my bladder, because again, it was done through a cystoscopy and a mild hydrodistension so the doctor could see. So it was like a mild washing of expanding my bladder so he could see what he was doing. Now, moving forward, because it didn't work out for me, meaning I was still having an urge to want to have to use the bathroom. I was still having frequency to use the bathroom. So I sought out another doctor, and she told me that instead of doing 100 milligrams of Botox, she would do 200 milligrams of Botox. And she figured like the pattern that she was going to use, because really, you never really know. Well, I'm not a doctor, but from what I read, you don't know what muscle for sure is going to be the aha muscle. I got it. So she did the two. No, she did not. I checked my medical records. No. Back up. Always get your medical records. She did 100 milligrams as well. She prescribed 100 milligrams. Yes, she did. And that didn't work as well. Now with that procedure, she did want to put me under. And I remember her visiting me in the room, the prep room, and I declined. She said, well, can we at least put an IV in your arm? I said, no, you can't. Because I've had it before, so I know what to expect. So you do have the option as a patient to be put under. But for me, I made it through the first time. And plus, I wasn't even given the option. It was done in clinic. Now, this was done in the surgical center of a hospital the second time. So again, I watched, and the prep, I'm always talking about the betadine from the previous videos, the cystoscopy one and the urodynamics. Once again, it stung so bad. Now I decline that cleansing agent though, just to be upfront with you. But that was my bladder Botox experience. It can be used for incontinence as well. You may be a candidate for it. Who knows? Talk to your doctor, but it wasn't a bad experience at all. It's nothing at this point that I'm interested in, but it's just so interesting that my initial clinical team who diagnosed me with IC, the doctor said at that time he didn't feel I was a candidate. But when you're in the position that I'm in, or we're in the position that we're in, we sometimes become vulnerable and just want to try just to see if this could be the magical antidote. We don't know until we try, and if the doctor is okay with it, then, we go for it. But in my case, it just didn't work out. But hey, again, you may be a candidate for it. So that's my bladder Botox story. Thank you for tuning in. And again, don't forget to subscribe. Don't forget to like the video. And until next time, peace out. Interstitial cystitis Chronicles 2. Don't forget the 2 on the end.